Welcome. This is Dr. Sunstein, and welcome to our podcast of the Spine Bro. I'm Dr. William Sunstein of NSPC Brain and Spine Surgery, and I have my trusty colleague right here.
I'm Dr. Rich O'Brien of Violent Spine and Sports.
Okay, and we have a special guest today.
Very special.
Oh, sweet.
Very, very special.
I'm proud to introduce my good friend and patient, Jay Jacobson, Esquire. He's a personal friend who is also an attorney, and he's dabbled in many different things. We'll get into all of his accomplishments, both in work and in outside of work.
How much do you cringe when you're in your office hours and all of a sudden a patient comes in and they're an attorney? Do you ever get like a guttural feeling about that? That you think, oh my God, an attorney, but then it's like so obvious.
It's I think a lot of physicians have a little bit of fear when an attorney comes in to see them, but I've learned to separate myself and just like I said before, when we treat patients, we treat them the same, whether they're an attorney, whether they're a physician, whether they're an electrician, a plumber, HVAC man. Doesn't matter what you do.
Well, but still,
we always I think a lot of physicians are afraid of malpractice cases and things like that, and we don't want to miss anything, certainly. But no,
you don't feel that way at all.
I do the same thing every time. It does. So to just by being consistent, it's like when I was a fellow, I remember asking Patrick O'Leary, who was my mentor, and he was at HSS, operating very many famous people.
You have great stories.
And
about
I asked
Patrick
him,
O'Leary.
did you ever get nervous operating on these people? And he said something that was really influential. He said, it doesn't matter who they are. I do the same thing every time.
That's right. That's what you have to.
So that's how you have to think of it.
But then this was even another layer because Jay is actually a friend of yours for many years.
He's actually a friend of mine for many years, and we're going to have him talk himself. But on and off, I've been seeing Jay as a patient for many years. Mm-hmm. Always had some lower back pain. We give him an occasional injection, do some physical therapy, things like that. But rather than belabor that, why don't we introduce Jay?
Sure.
So, Jay, why don't you tell us about yourself?
Well, before I tell you a little bit about myself, I just want to address Bill's comment about when an attorney walks in. As doctors, you should be so happy when your patient is a lawyer, especially a personal injury lawyer, because we know that most, if not a very small percentage of malpractice cases are valid. And so we immediately would see that the doctors, they do their best. They operate within the guidelines in the community, and there's no case. When you have somebody who you're treating who doesn't have that understanding, they're more dangerous than a lawyer walking in.
I think you're right. I think that it, certainly, and why would you even come into a doctor's office if you didn't know about the doctor to begin with, about their reputation
and we're
skill.
your best friends.
And
That's
plus,
right.
as a personal injury attorney, he's worked with many physicians, many orthopedic surgeons or neurosurgeons, and he's seen the results of other people. Mm-hmm. And the fact that he's chosen to come to your office is really, credit to us. Right.
And to even come, people would say, you shouldn't really operate on your friend. What if something went wrong or something like that? Then that can kind of make things tense, afterward. The fact that he came in, and chose you even beyond that, chose us to work on you, speaks, I think, to him feeling good about us as a team.
It should, and I'm very, very lucky. I've had a fantastic recovery. It's only been 4.5 months. I can't believe the recovery I've had.
That's very, very nice to hear.
If I was having a difficult recovery, and I came to my doctors and I said, listen, this is what's going on, I would be open to anything that you told me of why it was happening, and I would trust your opinion. I've known you both for years, and it was really, really comfortable for me to have you guys working on me. It really was.
So it was a pleasure.
It really was. So I am Jay Jacobson. I'm a Nassau County resident. I've known Rich for years. I've met you years ago.
Our kids went to nursery school together at North Shore Synagogue.
They did.
This is like dating like the late 90s, early 2000s.
Yeah, and our ex-wives.
Our ex-wives went to high school together.
It sounds like you guys have been through a lot together.
Yeah, we have. So I have a practice in Bohemia. We just opened up our Garden City office, and we have a Manhattan office as well. And I do strictly personal injury work. No malpractice, though. I won't touch it.
All right, so you may go to heaven.
Maybe.
He'll go to heaven anyway. And so when did your, I know we touched on it briefly that you were having some back problems intermittently, like anybody does. I mean, I know you do a lot of taekwondo, right? You do martial arts. You're an avid biker. You hike. You're very active. You had 3 children that you were doing all daddy activities with, and traveling and everything else. When did your back really start hurting you, though?
Probably in my early 40s. That's when I started treating with you. In my early 40s, it was exactly like that. You getting older, and I would do a martial arts class, and I would feel a little bit of a strain.
Now you're being modest, because you weren't just doing a class. You're a 5th degree black belt, right?
I'm a 5th degree black belt in Korean Taekwondo and a 4th degree black belt in traditional Japanese karate.
How many degrees are there you can achieve?
You can go up to 10 in both of those. In all martial arts categories, but usually when you hit 5th degree, 6th degree, 7th degree is more, you're getting older. It's not really because you're
just graduating.
Performing
Right.
better.
So what's the difference between a 10th degree and an 8th degree, in terms of skill, age. So there
experience.
you go.
Yeah,
Okay.
age and
So,
experience.
I mean,
sure.
when you're doing the class, you're actually an instructor in the class.
Yeah, I am what's called Kyosanim, which is the first chief instructor underneath the master. A wonderful school in Syosset. I'll throw a shout out to Master Mike Lee in Syosset on Eileen Way. Fantastic instructor.
And he's been your instructor for how long?
About 18 years now.
18 years.
Yeah.
And what degree black belt is he? 10th degree?
We don't even count him.
We don't count him. He's off the charts.
He is beyond.
He goes to 11.
There is no
as his
degree
final
that can
tab.
even describe his skill at this point.
I mean,
basically.
he's Olympic level talent,
Wow.
which is for somebody like me is really, really humble to be in his school.
And so you do both Taekwondo and Japanese karate.
I ended Japanese karate when I moved out of the city. I lived it like everybody else. I lived, a decade in Manhattan,
Sure.
And I had trained since I was a little kid in Japanese karate, and then I trained in Manhattan for 10 years after, college in law school, and then when I moved out to Long Island, I changed over to Taekwondo, better on the knees.
What is the
It's
major
like-
difference
yeah.
between Japanese karate? Is it really karate or karate?
Karate, but it's karate.
It's like, it's potato,
I can tell you, I
potato.
was just in Japan and Korea, and it's karate.
It's karate. Okay.
Empty
I just
hand.
want to make sure I understand it, the
Yes,
proper
that is the
pronunciation.
proper pronunciation, but most Americans will
What
say karate.
What's the main differentiation between Taekwondo and Japanese karate?
Well, it's funny that they all have differences. Muay Thai, Taekwondo, Judo, they all box the same. You put up your hands and you fight, it just like you would see in I guess mixed martial arts. Everybody
Muay Thai
fights
is
the
like
same way.
more legs.
Muay Thai is knees, elbows.
That's Thailand.
That's Thailand, which I have started training in that a few years ago as well for other reasons. my wife is Thai.
Yeah,
so
well, you
I've been visiting.
got to immerse yourself in the culture.
His first wife was Korean, and so he had to learn Taekwondo. Now he has a Thai wife.
At least you're going around the
He's
region.
got to learn all the martial arts.
So the basic difference is what they're focusing on in the training. So Taekwondo is more, until you get into the fighting stages of it, is more of an art form or like fencing. It's point scoring, it's quick scoring, it's made for the Olympics, and that's why you see, I mean, they do have karate in the Olympics, but Taekwondo has been in the Olympics for years, and if you watch the incredibly talented kids, when they're fighting, they're scoring points. It's like fencing. It's like fencing. But when you train in Taekwondo, and you're also doing fighting. So Taekwondo, really the basic way is the emphasis is on kicking, and Japanese traditional karate is all power and force.
That's why it's worse on your knees.
Yeah,
Japanese.
Yeah. You're doing a lot of low squat stances when you're practicing. It's a lot of leg work, and so it destroyed my knees.
So you were intermittently getting some lower back pain
Yeah.
since your 40s.
Yeah.
And then, but you never, you'd always seem to recover with a short course of physical therapy, maybe a local injection.
Yeah.
You had and you had some MRIs in the past
Yes.
that were kind of just, they showed some degenerative changes, some small disc abnormalities, but nothing that necessitated going to the operating room.
And
it was mainly lower back pain too. It wasn't so much leg pain.
There was no leg pain, and every time I would come in, it's over 15 years, and it was really 15 years. I looked back, can't believe it. 15 years, every 6 months to 2 years, I would have an overexertion. I would tweak my back. I would come into Rich. You would give me some trigger point injections and a course of physical therapy. And within 6 weeks, at most, I was done. I was fine. I never had anything but localized pain.
It was probably more muscular, that pain. I mean, there's a tendency among people to get MRIs very quickly.
Right, and they attributed that. I have 5 herniated discs. That must be the problem. You know? It's not always the problem.
And sometimes the radiologist impression is not quite accurate. Or they overread things.
Right, they overread things for the lawyers.
Some people overread for the. Yeah,
we're only having them read one view.
Yeah, exactly.
Don't read the other view.
But the bottom line is there's a lot of other structures in the spine besides just the discs and the.
You want to look at where the pain generator is from. Is the pain, if it's more muscular and topical and it gets better with, a cortisone injection over that localized area, it's probably more muscular. But when you're having pain that starts shooting down your leg, and you're getting numbness and you're getting weakness, that begs the question of something new is going on, and that's really what happened to you.
Yeah.
So you were kind of milking it along for years with the lower back pain, and then when did you start getting pain down your leg, and what happened?
So in September of 24, I was dumb enough to move my youngest daughter from apartment to apartment from Boston to Cambridge, and I tweaked my back pretty bad. And so I came in, I saw Rich, and we talked about it. It seemed like it was just more of the same. But after the trigger points and after some therapy, it just wasn't getting better, and you referred me over to pain management, and I had my first ever lumbar epidural in November. And then it worked fantastic. It worked absolutely fantastic. For about 4 months, I was doing fine. And then it came back. I did a second epidural.
So that was 2 months. Initially, you had 2 months before you had your epidural of pain down the leg.
No, it was just lower back pain. But what had happened was I started to feel a little bit of radiculopathy in the left buttocks.
When was that?
That was in the course of after the move.
Right. What I'm saying is. Okay, go ahead. Finish what you had to say.
It was just mostly localized, but for the first time, I had a little bit of a sensation in the buttocks.
But that was in September, you're saying?
September, yes.
So that's what I'm saying. I was like, you had some, we're going to call buttock pain below the back. That's sort of a radicular type pain in a way because that's L5 distribution, for instance.
Like a sciatica.
And so that itself was the first time you ever having like sort of that.
Yes.
So that
first time ever.
So that's why, and people like, they get epidurals. That's when epidurals, I think, are most effective, sort of a relatively acute or subacute situation to get an epidural, and then you had that situation.
And then it got much, much better. I was in heaven. I did skiing and I went back to all my activities. And then in early April or mid-April, I started to have this the localized back pain again, but really bad, without anything but that little radicular pain below the in the buttocks. And so I came in, I saw Rich, and he said, "Why don't you try another epidural?" And we did, but it didn't work. And then, during that time, from mid-April until I came to see you on an emergency basis, I was having worsening and worsening localized pain. But then on you perform surgery on a Tuesday, and then on it started to get worse the Wednesday before, the Thursday before, and then I started to, for the first time ever, have radicular pain going through my back, my buttocks, and into the groin, and down the inside of my leg, going all the way down to the knee, just following, I believe it was L1.
L3,
L4.
Yeah.
So I started to have all of this, and I woke up on Friday morning, I could not move. The pain was so extreme. I was dragging my foot behind me. I called your amazing office manager, Lauren, and because I think you were in surgery.
She is amazing.
She's absolutely amazing.
She is really just outstanding at care.
I've been lucky because I've had her since she was like a teenager.
I remember.
She's been with me for over over 25 years, and she's been fantastic.
So she was, I guess, getting messages back and forth. We had a problem because you gave me a script, and I went to one radiologist local who needed approval from my insurance. And then they were just dragging their feet. They didn't recognize that it was an emergency and I needed help. So I told them I would self-pay, and they said, we don't do that. And so
Crazy.
Which is crazy. And so
Who refuses cash?
They don't like cash, I guess.
So, Rich, you were able to get me into another facility that stayed open till 10:30 on Friday night.
It was a stand-up, right?
Mm-hmm.
Yeah.
It was a stand-up, and my mother, 83 years old, drove me, and I was laid down in the back of her SUV. I could not sit up straight.
Move.
I couldn't move, and my 83-year-old mother helped me into the MRI, and I had that completed. Rich
It's a good thing she wasn't wearing any heavy metal chains.
So we had a Friday.
That could have been bad.
Oh God, that was
a disaster.
that's tragic.
Tragic, yeah.
45. So Friday night you had the MRI, and then when did we operate on you?
Tuesday morning.
Okay.
He ended up going to the ER.
I
Went to the emergency room, right?
Because his leg was getting progressively worse. He called me and said, I really can't move my leg. I'm getting increasing numbness and weakness. And I said, you know what, Jay, just go to the ER. Let's see what's going on.
But it was great because not only have we known each other for a while, I've heard from my clients who have been your patients that you will communicate with them on an emergency basis on Saturdays and Sundays. And that's what you did because you tried everything you could to not have me go to the ER. And then eventually I'm like, Rich, I can't sleep. I can't breathe straight. And you were like, get yourself over to the ER. My wife was away visiting family.
She was in Thailand?
She was in Thailand.
Hence the 83-year-old mother driving you to the
and then
the radiology facility.
And my oldest daughter came in from Manhattan, and she just took a train, picked me up, and got me over to the ER.
Yeah, she's great, your oldest daughter.
Yeah, she is.
All right, there you go. So you went, and this is the MRI that you had before the surgery that we can look at as well.
Right, so why don't you want to tell us what the MRI shows?
Me?
No, Dr. Sonstein is the MRI expert.
I mean, I have to say, this is
It's an axial cut.
Well, hold on. Let's go start with the side view first.
Yeah.
This is here.
Want to show them the levels?
L5S1.
Right.
This is the sacrum. This is L5.
Put a 5
This is
there.
the canal where the nerves run. The spinal cord is up here. Most people don't know that the spinal cord is not run all the way down through the canal. It stops around L1. So what you have is a sac of nerves and fluid here. And the level that Jay's disc problem is up here, L3-4. And the L4, L3 nerve roots go, as you described, in a path the way you described it in the
Which goes down
top
the
of the
front
thigh,
front of your thigh.
towards the
into your
knee. That's usually L3-4. So that makes sense. So the sagittal here doesn't really show the lesion because it's more to the side. This is more of a midline cut. So now we're going to go to the axial images. So we scroll over to that. And now we have the bigger image here. So the axial images here, this is a cross-sectional image. This is an axial image. And what
Show them the front and the back.
this is the back, the skin of the back. This is the belly. Imagine you're laying there with your legs coming out of you. And then this is the left side. That's the right side. This is the canal, this white thing right here. These are two joints. And what you have here, if you notice that the sac is sort of round in the middle, and the nerve leads that way. And your side over
The left
here,
side.
it's crushed, the exit point of the nerve. And also there is some crushing of the side where the actual nerve is descending as well.
Right, so you have a small disc herniation there.
So you have
We call it a foraminal disc. Because it's right at the level of the foramen, the hole where the nerve is exiting.
this part is the problem. And it's a combination of really what we call an osteophyte, which is basically a piece of material that's a bone spur that's causing compression. And you also have a bit of a disc herniation as well. It's not a great image, but it does show that the foraminal area or the nerve tunnel is really compressed. And it doesn't matter if it's being compressed from the front or from the back, it's being compressed. And that was the area where your pain was generating from.
And at that, by the time you got to the emergency room, you were telling me your leg felt like it was disconnected from your body. It was and unbearable pain.
I was
We
dragging
had
it
put you
behind
on
me.
high doses of gabapentin.
Mm-hmm.
We had put you, which is Neurontin, which is an anti-nerve pain medication. It really wasn't helping you at all, maybe making you a little drowsy, but not really taking the pain away. You know, were you on painkillers too?
No.
No. Strong man. Anti-inflammatories.
Yes.
But nothing was really touching that pain.
I couldn't. It was the pain was excruciating, but it was more so I couldn't move the leg.
It was like
I
almost
could
like
not get it to
paralyzed.
operate.
It wasn't
insane.
functioning.
It was not functioning within I
Which is a
guess
scary
72
thing.
hours.
You put them on steroids down in the emergency room,
You got steroids, yeah.
Yeah.
which is it's a powerful anti-inflammatory.
Yeah, but it wasn't really touching them.
So you somehow, look, I don't know what your MRI looked like beforehand, but
He had some degenerative changes, but
not like this.
not to this extent.
So, some of it could be partially acute disc material. It could just be the fact that there's just a serious inflammatory process going on for whatever reason. But, that foramen is just almost completely, obliterated. So that was what needed to be addressed to decompress that nerve and the nerve below as well.
So we took him to the operating room the following day. We did it again at NYU Winthrop.
We do a lot of work at NYU Winthrop. Need more block time.
How was your experience? Well, we're not employees of NYU. They give us the honor of letting us do some cases there, but
we're in private practice. We like being in private practice.
we work for ourselves,
Patients want to see us. We can see them that day or the next day.
which is good because it allows us to have control of our practice. It allows us to see patients whenever we can fit them in. Sometimes we try to refer to, and it's not just NYU, but every system has problems. And once physicians are employees, you got to go through gatekeepers to get an appointment, and it can take months to get an appointment.
Right.
We
I'm
definitely.
sure you experience that as an attorney.
All the time.
When you have doctors that are working for big healthcare systems and big healthcare companies, it's really difficult to get through to the physician, get your patient in. And the truth is, those patients who need to be seen right away usually have pressing problems, and they're usually the ones who need immediate care. So I think it's a mistake not to be able to see, not to be able to see patients in an expeditious fashion.
We did a hemilaminectomy, correct?
We did a hemilaminectomy. So what we basically did is we took him to the operating room the following day, and we removed the lam. He only had left-sided symptoms,
We only did one side exposure to reduce the amount of postoperative
pain and swelling, and make it a little bit of an easier recovery.
We only exposed basically this side. And I'm also looking at this.
Look at that right side foramen.
Look how open it is.
How wide open it is.
See how the white, see how nice and white it is here.
This area right here, yeah.
So that's, basically what it should look like. On this side here where the circle is,
Crushed.
but you see this black, gray thing right here, this right there, this dark thing right here.
That's the osteophyte, you think?
That is either an osteophyte or it could be even acute disc material. I can't tell for sure, but what we did know is when we went in there, we did something called a hemilaminectomy and facetectomy, meaning that we removed part of this facet joint and made sure we followed the nerve all the way out to its takeoff.
We did a foraminotomy to open that foramen.
And foramen, and then
doctors like to use very
decompress it.
fancy words.
We learned
We just had to decompress
that we
your
had
nerve.
to
Free it up.
decompress. We had to
That's what I do with
decompress
juries.
both nerves, actually. The left L3, which is exiting out through here, because L3-4 foramen, the L3 nerve root is exiting out, and the L4 nerve root
Right, we got
as
both
it
nerves.
descends below. That was very important to really fully decompress that.
And we were very satisfied with that level of decompression.
We were very satisfied. And I think we probably added a little bone dust on the side.
We did because of the removal of the facet. Once you remove over a significant portion of the facet, you can render that segment unstable, and we don't want you to come back for any more.
But no screws.
No metal.
Just a little bit of dust, a bone to basically
bone graft.
consolidate over time so you have some stability at that level.
That's right. So you're not going to really notice much of a difference in terms of your mobility or your life in general. And there's no metal. Patients are they don't like the idea of a fusion, but they especially hate the idea of a fusion with metal. It's something
They
about
have no
the metal.
problem getting a hip replacement or putting metal in an ankle or wrist or anything else. But when it comes to the spine,
They don't, a lot of patients don't like metal in their ankles, and for fractures they want to have it removed after a while. They accept it because they have no choice.
Sometimes you have to remove it anyway in the spine. Sometimes in the future.
Yeah.
But most of the time we leave it in there because it really is a deep thing, and you don't want to have to basically muck around with it if you don't have to.
When this was going on, Rich and I we had a conversation about the minimalization of the procedure that you would like to get. But there was also talk about that if we go in and me and Bill see what's going on in there and you need hardware, we're going to do that. And my response was, whatever you need.
Do whatever you need, because at that point you were in so much pain. You're like, just do whatever you have to do and fix me, right?
Yeah. I mean, the truth is, when you're a physician, as a surgeon, that's what you want to hear from a patient. We strive to really do. We sometimes have disagreements. We might argue during the operation. Oh, I think we should do this. We should do that. But ultimately, we're really looking after what's the best thing for the patient. What would we want if it was our own family member? And you're really like a family member to a certain extent. In terms of wanting you to have a good result and really caring to do the right thing, so we really put the patient first, really, and that's what you want from your surgeon, and knowing that the patient has told you, I trust you, doc, do the right thing, that gives us the ability not to worry about, okay, we want to do the right thing, whether he's Jay Jacobson, good friend and attorney, or not. Doesn't matter. We want to do the right thing for the patient, what we want for our own family member. And that's ultimately what we did.
I always, interesting too, also when patients come in and they ask, I don't want this or I want that. It's not, I tell them, look, it's not an a la carte menu here. You know what I mean? You can't just pick on one side. It's not a Chinese menu? Pick
one from column A, one from column B.
It's not like that. We have to do what we think is right. I mean, if you don't like what we hear, then obviously you move on to some other surgeon. But this, you have to realize that we've been doing this for a while. We kind of know what happens. So by us saying, well, we'll try to do this, we usually do try to stick with that. But sometimes, you have to do what's right. And, when in the future the patient, his welfare is at stake, that kind of thing.
And I think what's interesting at spine, more than other aspects of orthopedic surgery, there are many different ways to do an operation.
Somebody
might do a full laminectomy. Somebody might do a fusion with putting screws and hardware. Somebody might just do a discectomy alone.
Some people may not even enter the back. They may just go from the side and try to open up the space.
Do an anterior, like an XLIF, or
people do that kind of stuff these day and age. But
and sometimes it's a triumph of technology over sanity, because really what you want to do is, like we said, free up that nerve.
That's the key, no matter how you do it.
And we saw your nerve, both the L3 and the L4 nerve roots, and we made damn sure that they were totally free, so that you might still have some residual numbness and tingling initially, but we were sure that it was decompressed, that your pain should get better relatively quickly, and over time, once it recovers, you should be back to normal.
I'm not into indirectly decompressing the nerve. I like to see that nerve. When you leave the operating room feeling good, you decompress that nerve.
Especially somebody who has like such a severe radicular type pain. Stenosis, indirect decompression, I think is good for like the X stop that we used to love to do.
But those were for people that really were kind of not great surgical candidates for laminectomy.
It was a little bit different, and they were having more stenosis pain that was with activity, and it got better when leaning forward.
But a young guy like this, you got to decompress that.
And you are a young guy.
You're a young guy.
I appreciate that.
You're young. You're younger than Dr. Sonstein.
I can't believe anybody would believe that. But.
Well, I can't believe I'm the oldest now. Because let's face it, as you get older, you become the oldest around.
But in your mind, you still think you're 21.
But I still think I'm 19.
Yeah, even better.
And that's why I love living vicariously for my children. I'm like, where are the pictures? Show me what's going on,
Sometimes it's a little dangerous.
Yeah, out of all the attorneys that I work with and work for me, and I am the oldest.
Yeah, well, it gets to that point.
I am the oldest.
Yeah. It used to be.
So after your surgery, what did you experience?
Well, the most incredible thing was, as I woke up in recovery, immediately.
You knew something was done to you.
No pain.
No pain.
No pain. And that it was, of course, you're waking up from anesthesia 2 seconds ago.
You're like, is it really no pain, or is it because of the anesthesia? Is it the drugs that they gave me?
Right.
I think people know.
I knew. I knew right away that the work that you performed was successful in that way. Of course, I was going to be really cautious about my expectations because I know that I was under. I guess I get you also, besides the anesthesia, the local anesthesia to numb the area and all that. But I could feel my leg, and I could move my leg, and I had none of that pain that was running down from my hip through the groin all the way down to the knee. I still have residual radiculopathy, but it's a strange sensation, maybe 5%, 10%. But you had told me that could take up to a year.
Up to a year, yeah. It could take up to a year because the nerve regenerates about 1 millimeter a day.
When did we do what month did we did your surgery?
April 29th.
April 29th.
So it's been almost 5 months.
July, August, September. Yeah, I mean, you're still in that period where your nerve is still recovering. Absolutely, it was crushed.
Yeah.
Yeah, it was battered.
Absolutely,
it was battered. I mean, to have those sensations that happen so rapidly, it was truly an emergency.
So fast. Yeah, I couldn't believe, dealing with that type of back pain for a decade and a half, and having a recovery in 6 weeks and conservative therapy, to have something that I just kept, like on Wednesday before, yeah, it was bad, but it was not. I wasn't entrapped. The leg was.
You didn't feel paralyzed.
And but even mentally, I felt that I would be fine. Just need to rest, and it just got worse and worse and worse to the point where, Friday morning, I'm calling up Lauren, just screaming, not screaming, but just like, I need help. Crying.
You needed it.
It was absolutely ridiculous.
Help. You needed
it's a painful
surgery.
thing.
So look, you try to get patients through conservatively, but sometimes you have to act surgically.
So when did you start going back to martial arts at some point?
I did.
When did you do that? Like you waited at least 6 weeks, I assume.
When did you let because
I called you. I actually
6 weeks.
Generally the first month I tell people to kind of take it easy, let yourself recover.
Yeah, I would.
And then you gradually start going back to your activities after about a month.
I think a month is a good amount of time.
It's
you're always healing though. You're still healing. You still feel like you're healing. But
we do the operation to get you back to your old self. So you don't want to get atrophy and lose that ability. So we tell you do some light, maybe some non-contact taekwondo initially, and then gradually
stretching.
And then also use pain as your guide. If you're starting to do some exercises, some stretches or activities that are irritating it, don't do it. Don't push it.
Well, that was so. I went back after 6 weeks, but with most martial arts classes, including the one I do now, the first 15 to 20 minutes are always stretching, calisthenics, and I talked to Rich about what I can do, leg raisers, well, just one leg bent, all the things that go in it. But you also gave me some really good advice. It was that talk to your physical therapist. They're the ones that have the hands-on with you 3 times a week. They say, and so this is what I'd like to see you do, but if the physical therapist thinks you can push. And so I have a really good physical therapist out right by my office in Suffolk in Bohemia, and they were great. And we went back, I went to class. I only did the first 15, 20 minutes of calisthenics and very, very light. Up until last night, I was in class, and I did the first 30 minutes. I started to do traditional martial arts. I can't really kick yet on my left leg above the hip. And then I just felt a little bit of a soreness in the back. I stopped.
That was good.
Stopped.
Yeah.
Good common sense.
And what I usually tell people to do is, before you work out, take a couple Advil, almost like prophylactically.
Mm-hmm. I think
that can be helpful.
I always do that. It really is very helpful.
Because you're going to be sore afterwards, but instead of getting to level 10 pain, maybe you'll get a level 5 or 6, and that's much more tolerable, and you can do the workout.
But you won't let me do my mountain biking yet.
That's going to come soon.
Because of the bumps.
Well, he's had some crashes.
Yeah,
he's had some incidents.
Well,
so
that's probably
he's not a normal mountain biker. He's a little aggressive sometimes.
Okay. Where do you mountain bike?
All over the country.
Yeah, we'll do
like
all over the world too.
All over the world.
So
his bike is like more than some people's cars.
Which bike? I've got a lot. I've got 5.
You got 5 of those expensive bikes?
I do.
Wow.
I do.
All right.
They're all for different things.
That's great.
Including a road bike. So you told me to stick to road.
So because the problem is when they bike in the jungle in the forest, a lot of branches and trees, and roots.
I can understand
stuff
why.
A lot of obstacles.
Should hold off on that. But the problem with There's no place really great to ride, I find. I mean,
Well,
There are bike trails in Syosset.
They're fantastic. So
where?
there's no
During COVID, I almost got
tradition-
killed by a bike that was riding on the regular human
we
trail.
say, go to Bethpage State Park, but I mean, what are you going to do? You have to drive your bike over there. I mean, I want to just
You gotta drive. Well,
Well, yes, you do have to do that. But Long Island is actually an absolutely fantastic place for mountain biking. But it's not traditional mountain biking because there are no mountains, but it's trail riding. And so just the technical difference is on Long Island, we have fast switchbacks, which is the trail system out here. I absolutely love it. So when I mean a switchback is all of a sudden you're flying down the trail and it's a quick right 170-degree turn and then 10, 20, 30 of those turns as you're going through the woods.
Where do you go?
I do Bethpage, but Syosset Stillwell Woods has a fantastic trail. There's a great park by Northport by the VA hospital. Farmingville has the most incredible trail called Glacier Ridge, right by Town Hall. Then it goes all the way out to Calverton, all the way out to Stony Brook.
you're a competitive mountain biker.
Not anymore. I
But
stopped.
you were.
Yeah, I used to race, but it's like weekend warrior racing. All the dads, you would race your category. The year before last, of course, I didn't race this year. I was scheduled to race in May in Stillwell. In 2024 May race in the 50 over category, I took third place.
Pretty impressive.
In category 2. There's only like 8, 9 guys in the category. It's not.
You
that-
enjoy it though, right?
I'm a competitor.
You
so
get a bronze medal for third place?
I did.
That's pretty good. All right,
did
next
get-
year you got to go for silver and gold. They say the people who are the happiest at the medal ceremony at the Olympics and these kind of events are first place, who got the gold, and the bronze medalist.
Yeah.
Second, the guy who came in second is always like, damn, I just missed it, and they're a little bitter.
They're always bitter.
The bronze medals, at least I'm on the stage here.
Right, exactly. That's the attitude.
When I competed in martial arts and in mountain biking, I hated silver medal.
Yeah, because oftentimes you're just like a 1/8 of a point, or some minimal
Ridiculous.
mistake, something ridiculous, and
Yeah.
you could have gotten the gold.
Yeah.
So it's a little upsetting.
How about
but
skiing? You still ski?
Yeah.
So maybe
He's been.
we're gonna.
You can return to skiing for
I would
sure.
let him go skiing.
Absolutely.
All right.
Absolutely.
Got the-
Dr.
line.
Sossin's a big aficionado of skiing.
I love.
All right.
I
He went
can't wait.
skiing in where'd you go? You went to Switzerland.
Zermatt.
That's an
Wow.
awesome place to go.
That is
You
amazing.
also go out west a lot.
Can't wait to go.
You have something scheduled already for
Yep.
February?
I have not February, March.
For March.
March and April.
Where are you going in March?
March, we're going to go to Beaver Creek.
Oh, very nice.
Been there every year.
That you go there every year?
I go there every year.
A buddy of mine
I've been to
has
Hunter
a
Mountain.
house there. Been to Hunter. The craziest place I've skied in, or not really
Vermont.
crazy, the most exotic was was Norway.
Oh, that
How was that?
Yeah, that here is amazing.
It's absolutely fantastic because you're starting above the tree line.
Did you go there in the wintertime or in this really it must have been freezing cold?
It's darn cold. Yeah, I went both times. I went over New Year's. My wife's sisters both live in Norway. Married.
There's a
to
big
Norwegian
Thai
guys.
community in Norway.
Big Thai community.
Interesting.
Yeah, that's because the Scandinavians vacation in Thailand, and so a lot of times the men connect with local women, and then they bring them back to
There's a
Norway.
connection. So is your sister-in-law, is your brother, I guess your wife's sister's husband,
both of there, 2 of them.
and they're Norwegian?
Yep,
Interesting.
Vikings.
Vikings.
One of them is a Viking, like
The real Viking.
And
He's
you've been
big.
in Norway, and you've been in Norway skiing. That's really
yeah, it's kind of cool.
That is very interesting.
They do helicopter skiing there too, right? But because it's so
I don't know.
you haven't done helicopter skiing.
No,
yet. That's
I
a little crazy.
It's a little crazy. I heard people.
There's no ski. That's a little dangerous.
No, it doesn't necessarily have to be, right?
No.
It depends where they drop you.
No, if you're a good skier and you're in control, you could.
Well, it's not really a ski. It's just like, oh, I'm going to
off-
ski
you're
here.
off- you know,
There's no trail.
You're off trail.
That's the best part. You could be a horrible skier, and if they drop you at the right spot, you just go.
You could also die. You hit a tree.
Listen,
So bad things
Well,
can
if you're
happen.
above the tree line, you're not going to hit a tree.
I get a tree
Until you're
in
not below,
Bethpage.
until you're below the tree line.
You're hitting rocks. Look, I could hit my head in Bethpage.
That's
Knock
right.
on wood. Hopefully, I don't do that.
Well, hopefully that doesn't happen.
yeah.
Right.
I'm starting to slow down, gentlemen, in my
That's all
my
right. Just do
older
what you
age.
enjoy. You do. And, I don't ski anything challenging at all. I just like just being out there. I love being out there and looking around.
It's a good feeling.
It's a great feeling.
It's a good feeling. You're out in nature. You're feeling the wind against your face. But if it's too cold, it can be a little painful.
Such a baby.
I'm a baby.
Such
If it's that's why March is probably a good time to go.
Cold
It's too cold.
the
I don't want to
winter.
get frostbite. Well, I went skiing in Hunter Mountain
Which is the coldest,
several years ago, and
iciest place.
I had I had spoken to the instructor. I wanted to get lessons because my ex-wife was not at all into skiing, and I said, let me try. Let me learn how to ski again. And it had been since high school that I hadn't gone skiing. So I called the guy up. He says, yeah, we'll give you a lesson. We'll give you the first lesson of the day. Get here early. I was planning on skiing on President's Day, and so I get up there the night before. I get up really early the following morning, and it is bitter cold. And the owner of the inn that I was staying at was like, "How you feeling?" I said, "I'm freezing." He goes, "That's because it's 20 below."
Oh.
And our heater broke.
No.
I said, "Oh, okay, so I'm not crazy." I get to the ski resort in Hunter Mountain, and literally there was nobody there because it was so friggin' cold that people were just like, "I'm gonna hold off on the skiing today." I basically had the slope to myself. There was like about a handful
You
of
mean
other
the ice
teenagers, and it was a
Well,
sheet
if
of
it's
ice.
Hunter, no one.
I had a
Serious.
Russian instructor who's telling me how great it is that the ski slopes are empty today, but it's going to be a little icy, but it's okay if I can learn how to ski on the ice, I'm going to be good to ski anywhere in the world. And I'll tell you, I graduated from the greens to the blues, and I felt pretty good at the end of the time. Needless to say, the following day I chose to forego the skiing because it was still literally 30 below on the mountain. It was too cold. That's
those
what I
of
mean
us
by
who
too
ski.
cold. Okay, you can call me a wuss and a wimp, but I mean he's
No,
skiing.
no.
He's skiing in Zermatt where it's like in March and it's like 50 degrees.
Well, it's interesting you're saying that because like when you ski on icy patches, one of the things my instructor told us in Zermatt was that you just skid down on the sides. You don't try to fight it. You don't try to turn on it. You just deal with it for a while until you hit something.
It's almost like driving
Don't
into
try
the
to
ice.
ski on the ice.
Exactly right. You're eventually this too
You just
shall
sort of
pass.
slide on it, and then you pick up what you have to do. That's what you have to do to get through
Yeah.
ice.
And not to mention how cold it was. I had hand warmers, and even despite that, my
skiers-
fingers were going numb. And
Skiers don't ski under those conditions. We go home.
clearly, the slopes were. I told you the slopes were empty that day.
Ski another day.
Yeah, but I had the appointment set up long in advance.
I'm
So
gonna take you skiing
I'm gonna
place.
we're gonna.
I'd like to see you
we should-
guys
we should-
stuck on a lift.
What,
That would be great.
All three of us should go to Beaver Creek.
Oh my god! And have dinner.
Beaver
at
Creek's a great-
Splendido.
We'll have a
Great mountain.
That's a great place to have dinner.
Oh man, I have some.
Oh yeah, at the
Splendido and the Maribel. I
at
love
the
those
Ritz.
two. Oh, that was there's some,
There's Ritz Carlton right at the bottom.
There's
It's-
some
You
very
guys
nice-
are living above my means. I can't afford this place.
It is a very they cater very nicely to people. And
It's
families.
amazing.
Yeah,
It's
worth going.
It's not where it's not where like the locals go. They don't go to Beaver Creek. They go other places.
You go to Vail. Vail's right
Vail or-
15, 20 minutes
The
away.
après ski is also very good, and you go to the jacuzzi, have the hot chocolate,
The smaller
soak up
mountains
the
are better.
atmosphere.
They serve cookies at 3:00 in the afternoon.
It's like instead of like British tea, they have cookies and milk and
Oh, it's
hot
fantastic.
chocolate.
They have a great outdoor après ski. They've got a giant fire pit, real fire.
Yeah,
It
it's nice.
smells good.
It's really
Smells
nice.
good. It's great. It's a great party.
It makes you feel warm and cozy. Those kind of situations.
Yeah, then you got to get home.
But you can definitely. I give you my blessing.
Thank
Definitely.
You may go skiing.
Love it.
All right.
But start off in McCoy Park. You know what I
park?
mean? There's
a little baby.
There's a new. It's not. I mean, it is a
Are
beautiful.
you telling him to go to the kiddie?
You know what's great
skiing?
about Beaver Creek is that the beginner places are at the top of the mountains. Usually that's not the case in most ski resorts. That's what's so great about Beaver Creek.
Why
you
is
got
that?
you got Buffalo Park.
The way the mountain is.
Way
Way
the
the
mountain is.
Yeah.
It's special. And then they open up this relatively new place.
So the green zones are in the higher elevations.
Yeah, for the most part, and they're really nice.
They built a nice intermediate mountain just a year or two ago, where
Yeah,
just like all blues, but it's the best because there's a restaurant overlooking the mountains, and they did for years we've been going, and you would just look at this, and you're like, well, they should put that ski trails in there, and then eventually they did. So it's really nice to sit up there and just drink,
It's a
hang
good-
out.
Oh yes.
And it's it's Colorado, it's Colorado.
Colorado. Yeah, so
Get to do more than drink.
That's right.
well, it's legal in I assume you're talking about the marijuana laws in Colorado. So
Well,
it is legal in New York now
It's
too.
legal in New York. Everybody,
It's legal almost. I think there's a few states that it's not legal in.
Florida. It's not. You can't do recreational there.
Maybe some of the red states, Texas.
I don't know about that.
It is not legal in Texas.
Texas would not seem to me like
Been to Austin.
Places that
Not
would be,
legal.
Not
Not
legal.
legal.
Initially legally, but maybe eventually. But in any event, it's fun because it's just fun to just be outdoors.
Yeah,
Yeah.
the fresh air. I mean, the quality of the air is different out west.
It's
You know?
it's a high, you're
Yeah,
pretty
it's
high
beautiful.
elevation. You go up to 9,000 feet up at Beaver Creek. But I've never really felt that. A lot of people.
Did you feel
I
the
never-
altitude sickness?
I don't get that for
I
some
do.
reason.
You get it?
Yeah, it takes me the first day. I'll just take it nice and easy. I'll just stick to the blues, maybe a couple of black
They
diamonds.
box you on the mountain.
Don't
so that-
go down the Birds of Prey or Grouse Mountain when you get out there.
Yeah,
Try to
it takes a
avoid that.
day. Yeah, the friends that I go with, they're all much better skiers than I, and I will take a day to start skiing with them. I need to get acclimated.
You need to get acclimated.
Well, they're out there, and then the guys count how many days they ski per year. They're skiing 18, 20, 25, which is a lot.
That's my goal.
That's a lot.
Do you have
That's
your
my
own? Do you have
goal.
your own skis? Or do you rent?
No, I have my own equipment.
I bring everything. I need my own stuff.
It's my stuff. I don't
also
feel
don't like to have to
comfortable
like get there and then have to worry about going to get the skis. You know what I mean? I want to just have everything there and ready to go.
But if you wanted to, you could really get great concierge service out west. They'll bring you the highest quality equipment. They'll fit you. They'll take you, give you a run to go on. It's absolutely fantastic what they'll do.
That's true.
Right.
For a price.
And your knees are good. When you're
My
skiing.
knees are good. I still, believe it or not, that when, and you'll believe it, of course, this is you. When I first started treating with you as my orthopedic surgeon, was for my knees.
Right.
Right.
And we've been giving you hyaluronic acid
I
injections.
need my shot, by the way.
Dr. Sonstein is also a patient. I give him hyaluronic acid injections.
It helps.
I think you're due.
I'm due. I actually was going to come
We
over.
have it. We have it ready
I think
for
I'm.
you.
What are you doing tomorrow?
You can come today.
Today I can't, but can I come tomorrow?
Tomorrow you can see my PA.
No.
But I did that a lot. I haven't done that in years and years because I am now,
Maybe I will come today.
I really, really work on my legs.
You know
More
what?
than
I wear a
used to.
brace when I ski. My knee. I use a hinged brace I bought on Amazon. which
I
is
have on my
fabulous.
left, yeah.
And it's no problem because
No
you just put your long underwear over the brace. I mean, and it fits fine. And you tape it on so it doesn't fall down, and your boot kind of keeps it up too. So it's like.
And as far as your back goes, with the left leg being numb and weak, that's resolved now. Right, 95%. So
It is 95%. Right now, I feel so good. I don't want to say it out loud.
You don't want to jinx it.
I don't want to jinx it.
I don't believe in that.
I know, of course.
If things are going to happen as it happens.
Well, I'm going to say it on camera. So it is. I feel so good that I'm worried that this feeling about feeling so good won't last. So
It will
I'm
hopefully
taking
last
it
you may
easy.
have a recurrence of pain every so often. It happens,
Right, and that's why maybe we should take a couple of Advil before you ski or do anything strenuous.
Sure.
With Taekwondo, things like that. Just
Or a shot. Hopefully, I won't be back for shots. I won't be back. Just
No.
my back feels. I'm still a little sore, and I'm still not lifting, and I'm not. So was it BLT? I'm not bending, except now I can. I'm not bending and lifting too much, and then I haven't twisted in
Right,
4.5 months.
you can
I
start
haven't even
doing stuff.
twisted.
Just use pain as your guide.
Because when you do your Taekwondo, that involves twisting,
And so it's
major twisting.
It is something that I am not doing yet, and I think that you gave me the 6-month mark before you
Yeah,
would
you're
feel
almost there.
comfortable, and it's another 6 weeks. Oh wait,
Yeah.
That's very nice and conservative. I like that. 6 months. I think
wants
you
to go
should
to
be
full
good.
activities.
I think that's pretty good.
Yeah.
After that, it's like you plateau at that
Yeah,
point.
every patient's different. Remember, we had that other patient who was he wanted to get back to running marathons very quickly, and he did. And he was okay with it, but he had some pain when he was doing it.
Yeah,
Everybody's got a different everybody's got a different pain threshold.
Mm.
It's what you can tolerate, and how much risk you're willing to take.
And everyone
I
has
think younger people
different problem.
are like to take more risks than older people because we have a little more experience, and we're like, yeah, I don't want to do that again. So
yeah, I'll stop now.
I'll wait. I'll wait the 6 weeks. It's okay.
Yeah,
Yeah.
I'd say it's probably a good idea to wait, for 6 months to do any major sort of, exercising
Well,
or something.
one
And
of the-
have you traveled? Have you go? I mean, your wife's family is in Thailand. I know you periodically go there and go to Norway. Have you gotten any long trips since then?
since the surgery, no.
Yes, but
No,
you're clear to go on a long.
Just
It's a what is it, like a 12, 15-hour flight
How
to.
long is it Thailand?
How long is it? 18 hours?
the trip minimum would be 23 hours.
Wow.
And that's 2 flights with an
23
hour and a
hours.
half hour layover. You must
There's
be
no
in
direct
the air.
flights to Thailand from New York.
Not from New York, only from California and Seattle,
Really?
West
I didn't know
Coast.
that.
Yeah,
So if you want to go to like Phuket or any of those places, like how do you get there? What do you have to
Bangkok.
Well,
fly
no, you can
fly to Seattle or San
last
Francisco?
I go once or twice a year. Last year I went and I flew from JFK to Singapore, Singapore to Phuket, right? And then
What airlines?
I flew Singapore Airlines, but we're big fans of EVA, which is Taiwan's airline, or Cathay Pacific, which is Hong Kong, is gorgeous. People sometimes they'll fly a 12 and a 10, which is going through the they go in Emirates or Qatar Airlines, which is also
I think that's a good idea, actually. If you're going to go on something like that, go stop at a place like Singapore. Spend a couple days in Singapore, then wander over to Thailand.
We will do that, and but I'll usually hit. Our house is in the north, in a place called Chiang Mai. That's where I do my mountain biking. Also, it's absolutely fantastic mountain biking there.
Man, you
Better,
really-
better than America.
Different, scary.
Sounds like you got.
Do you have an expensive bike in Thailand too?
I have 2. Yes,
Wow.
I have 2.
You got hooked up there. That's nice.
I know
You
some
only live
people.
once.
I bought my mountain bike. It's a YT Jeffsy, which is an American company. I bought it from a Swede
In Thailand?
in Thailand. He's an expat who lives there, and he had to stop mountain biking because he broke his hip mountain
Oh
biking.
God,
So
it's dangerous there
so
too.
I sold me
Obviously.
an absolutely fantastic bike.
I hope you got a good deal.
It got a great deal.
Okay,
That's
good.
fantastic. Well, I think we got. I think our time is coming to an end here with our time limit here. So it's great to learn all about these things, actually. And learn about the things you're doing, and it's wonderful that you feel relief enough to do these things now. And
I feel
look forward to
That's
it.
the point, And I remember
You got
when I informed Dr. Sonstein that we have an emergency in the emergency room and it's Jay, he's like, "You're going to operate on your friend?" I said, "Yeah, we're going to do it because nobody's going to do it better." So we're really glad that you had a great result.
absolutely
You're going back to your normal life. Our friendship was actually strengthened, not weakened by this whole experience.
That is true. And I got to tell you, if you had declined to do it, both of you, and by the way,
if we
I
didn't
know
feel like we could,
I
we
knew
would
that
have.
you'd be there because I know how you guys operate as a team.
You're a
I
team.
would have been. I don't know what I would have done. How's that? It wasn't even in my mind going anywhere else, and that's just not only because of that I've known you and we're friends, but my ex-wife, you did an ACDF on her.
Yes.
She's absolutely fantastic.
I remember
Absolutely
that.
fantastic.
I think I remember that.
And you did her mother.
Yes. We did an X stop on her mother.
Yeah.
And she feels great. The biggest kudos she has to you guys is that she feels taller.
I really wish they
She
they
does
stopped
because
making,
you know what she
Tiny.
used to hunch. She used to walk a little hunch forward, and
Yep.
by fixing her,
You
she's able to stand
you
more erect.
distract open the space.
That was one of the cases we were talking about before.
It's really
indirect
sad that they
decompression.
stopped making those X stops. Those things were great
She
for
is
people
in
like
heaven.
that.
She's in heaven. And it's years ago. It's like a decade.
Yeah, it's more than 10 years ago.
Yeah.
Jay, it's
Yeah.
really great to hear.
Thanks for having me.
Pleasure. Thank you for coming.
Thank you very
We
much for
appreciate
coming.
you very much.